What we've seen with Delta is that it is highly transmissible, and it's been equated to chickenpox in terms of how contagious it is. So much, much more contagious than the original type of SARS-CoV-2, and certainly even against the Alpha variant or B.1.1.7. Vaccination, we know, is not 100%, but we know that it's still continuing to protect people primarily against hospitalization and death from COVID, as well as from long COVID, where you have symptoms for many weeks or months. There was a recent study that was published that found in a large outbreak of 400 and some people, 3/4 of them were actually vaccinated. So that's not surprising, given that most of the people in the population were vaccinated, but there was still a large level of community transmission. The good news about that, though, is that most of them who were, I think 1/4 of them didn't have symptoms at all. Those who had symptoms were mostly mild, and I think, were only 5 hospitalizations out of that entire group and no deaths. So we are excited that the vaccines are continuing to protect people from the severe consequences of COVID, even if they might not prevent every single case of COVID. In terms of whether vaccinated people can transmit to others, that same study suggested that people that were vaccinated might have a similar viral load to people that were unvaccinated. I think that the jury is really still out on that discussion, because the test that they used did really not differentiate live virus, contagious virus versus dead or killed virus. So we know that, if you're vaccinated, your immune system already has that it's been primed, so it can respond much more quickly when you are exposed to COVID, and will really take care of the virus much more quickly. So biologically, I think it really makes the most sense that you're not going to be as contagious to other people. Does that say you cannot transmit? No, but I think the likelihood is less likely. So it's really twofold. It's protecting yourself against severe disease, hospitalization, and death, and potentially still protecting other people from transmitting if you do still become infected, even if you're vaccinated.